Good afternoon, everyone, and good morning if you are listening us from the Americas. This is the episode that is part of the BTS talk dedicated to digital health. My name is Tino Martí. I'm co-director of the BTS Barcelona Technology School Master in Digital Healthcare. In this master, we train students to have a deep understanding of health systems, discovering the difference between countries in terms of their configuration. We also pay a lot of attention to the different digital technologies that are applied in digital healthcare and the methods to implement innovation. In this talk, we are going to take a first-person approach to learn from leaders in the digital health field and how they cope with the challenges of such a complex and strained sector. Today, we have with us Dalibor Frtunik. He's the CEO of Sorsix. Sorsix is an Australian technology company specialized in digital health with operation in different countries and base the operations in Europe, in North Macedonia. Good afternoon, Dalibor, and welcome to this talk.
Hi, Tino. Good afternoon, and good afternoon, everybody listening. Or good morning, actually, if we have from the
we have audience from all over the world. So I would like to ask in this first-person approach, knowing a little bit more about you and Sorsix. So if you can introduce yourself and what Sorsix is doing in the digital health field.
Cool. So I'm Dalibor Frtunik. I'm actually from North Macedonia, but I grew up and was educated in Sydney, Australia, and that's the headquarters of our company. So for me personally, I am a science actually background, but I always had a passion for technology. And not long after kind of entering the professional sphere, finished a 4-year degree in Australia. In science, they have this like a half master's where you don't really finish a master's, but you do some research. So that was my program. I found that has given me a good grounding generally in digital health, because digital health is not just a technology discipline. It's not really just a health discipline. And there is a whole pile of process engineering, that really sits underneath everything that goes on in healthcare. When Tino first told me about this program at BTS, I was delighted that such a thing exists, because I think this is a huge gap in tertiary education globally. But anyway, this is meant to be about me. So I essentially had a more general public sector technology consulting background, which didn't really use my education, but that's kind of how we made our start. And in 2012, during a visit to Macedonia, I actually met the gentleman who's now our CEO. His name is Dragan Shakpaski. And at that time, Macedonia executed a astonishing and successful digital health reform, which we'll talk a bit more about maybe later in the talk. And I just said, I want to be involved. So we very quickly got together and created a spin-off company from our original companies, which is what is Sorsix today. So it's been going since pretty much that time. The goal being to commercialize what had been done here in Macedonia globally. And that was, that it's taken a while, but that has achieved some success. So the company Sorsix is now about 150 people. We're a very engineering heavy company. Maybe 80% of the team are engineers, mostly software engineers, although we have some other engineers as well. And our focus is basically digital health, public and private. We're one of the few companies I know of that tends to be kind of 50-50 split between big public projects and the private sector. And our kind of mission as a company, we say it's to solve human health. And what we mean by that is, there is such good equipment in the world, modern technology, new medications, drugs, treatments, devices. I wear a smart ring now, this is coming. But actually delivering that to a person or patient, and the process of healthcare being executed is I call it like plumbing. It's a back-end challenge, and that's the focus of our company. We provide digital solutions for clinical work, but also administration, and especially patients and patient engagement. So that's kind of our main focus. Something that we've been very heavily focused on in the last few years has been supporting the idea of more kind of structured clinical practice, mainly from an administrative sense. Public healthcare in most developed countries is all about the process you have to take to get the right healthcare. to make sure that resources are not wasted. And this pathway management can be very inefficient and cause problems. So our goal is to break down those barriers through digital tools, basically, and make everything smooth and efficient, reduce double entry. We have some strong successes in that field, particularly here in in Macedonia and Serbia, so Europe adjacent, we call ourselves, but also in the public system in Australia and in New Zealand.
So I think here two elements. First, you say your focus is now in healthcare, and also you have experience in different countries. I would like to know a bit more on how your company is managing and navigating the different regulatory challenges, because each country has a completely different legislation setup. And when we talk about innovating healthcare field, sooner or later you will be facing the wall of legal constraints. So I would like to know how you have managed this in your experience in Australia or in North Macedonia or somewhere else.
Yeah, I mean, this is very topical in healthcare. It's one of the most regulated sectors in the world, and with good reason. You know, patient privacy around healthcare conditions is extremely important and extremely sensitive. So we actually, I'll just mention that as a company, we actually take a philosophically different view to regulation. To I think some of the market kind of vibe that I have gotten. And what I mean by that is this: we don't see regulation as a burden. It's the cost of doing business to keep people safe. But taking that a step further, for us, regulation is a risk mitigator. Digital health is by its nature innovative, right? If digital health was a solved problem, if everybody used the same digital tools and everybody knew what they were doing, we'd be having a different conversation. But no one has the right digital tools yet in the world today. I have to say it. Obviously, we're the best. I'm sorry, it's in my contract. I get that out of the way. But jokes aside, digital health is a fast innovating space, and good regulation and sensible regulation is actually a boon for the company, because if we comply with the rules, we know, a huge government-backed, regulation is coming that says do this, and we're happy that people will be safe. That's perfect. It's music to my ears, as leading the company, because I say, okay, we can play by these rules, and it will be okay. We still do our own thing, and I think we probably are the most compliant company in the world because of our kind of global focus. We expand. We comply with the GDPR. So people in Australia and New Zealand, where the regulations are a bit weaker than the GDPR, sometimes ask us, are you going to be compliant with the local rules? We're compliant with much heavier than the local rules, and that's a boon to us. I see Europe and European healthcare as a big thought leader in this space. Some of the most advanced legislation and regulation is in Europe, and it doesn't need to be a blocker for innovation. So from our side, of course, this is still a cost of doing business, but I see it as a sensible cost and a necessary one. From our perspective, we actually have a dedicated risk and compliance officer with maybe 20 plus years experience in compliance across the public sector, and she manages this as a company. But we are also connected with various bodies that certify. So we took an approach to get ISO certified as well as compliant with GDPR and things like this. I see a lot of value in ISO certification, because it gives us some comfort and confidence that what we do makes sense. We are audited, very clever folks who have seen every kind of business come in and say, yes, this is a good way to work. That provides us additional comfort that we're doing the right things, and it lets us tell that to our customers. Sometimes a public procurement or tender will actually call for ISO certification, and we have to have it, but it's more than having to have it. We use it as marketing. When we go to the private sector, we say, listen, digital health projects, particularly when they're transforming legacy business processes, can be very risky. Not just to deliver the project, but also that whole privacy and compliance side. We come in and say, here's our certifications. Here's what we've done to make sure that what we do is safe. And, I guess in the short answer to your question is we take a very positive view of regulation because we see it as a risk mitigator, not as a business cost. I mean, of course it is a business cost, but it's an investment as much as it is a cost.
I like this concept of risk mitigator because it resounds something in contrast with the barrier that normally legislation is bringing. It's a trade-off between innovation and compliance always. In this discussion between innovating and compliance, technology is key, and we are observing how technology is progressing that fast, and especially in recent years with artificial intelligence and particularly generative artificial intelligence.
Mm.
I would like to know, and this is again the first person approach of this interview, how you and your company is facing with or coping with getting keeping abreast of all these innovations, and how you can uh, transfer these innovations to your customers in the shape of valuable services.
Yeah, I mean, this is a really good point. For us, we actually see ourselves as a technology company first. Healthcare is our focus because we see it as a area that is crying out for even more technological transformation. I mean, healthcare and the legal profession are like the last two sectors to get any serious technology shakeup. And this is somewhere where we see a calling. I mean, like I say, our company's mission is to solve human health. But that doesn't mean we're a health company. We're a technology company. Healthcare is just where we are. And we took a very early decision to try and not just stay abreast of the best technologies globally, but to really make sure that we are current in technology. And this was for a number of reasons. One is it's kind of in our DNA as a tech company, but another one is, we talked about the regulation and safety before. It's something that people always talk about, but I don't think the severity is understood enough. Cybersecurity is a huge deal. And every year sees more incidents than the previous one, right? That's been the trend for more than a decade, or even probably longer than that, since I've been looking anyway. And if you don't stay abreast of technology, you will have a problem. It's not like the old days where, a device had some software built in and just that's the machine. If we want to do the right thing in healthcare, it has to be integrated. The internet is default here. We actually built our solution in the cloud to begin with. And in healthcare, you see a lot of solutions that involve installing software. That model is not going to take anything forward. So because we see ourselves as a technology company, and I don't say this in the marketing, but I'll share it in this talk, we have completely ripped up the product and rebuilt it from scratch 3 times, or rebuilt twice, built once and then rebuilt twice, because technology moved on. The product was initially built with a framework called Tapestry. That was one of the fastest technological frameworks at the time. And it just doesn't have the same level of attention and maintainability. So we moved, we changed. We built on a new stack, and then we changed the stack a little bit again. We're very big on open source technologies because, once upon a time, commercial products were more advanced, but now there's really no difference. It's all about how you implement it and how you use it. That's why we have such a high percentage of engineers in the company. We are directly touching core technologies as we work. And that's an investment that we make as a company, effectively an R&D investment, which enables us to know that we are at the forefront. Just something healthcare specific here. Something that in particular has been getting more and more popular. I mean, this has been going on for more than a decade. Automated testing is a huge deal. And when you touch clinical systems, I reckon many clinical systems in the world, when truly analyzed, are not safe enough today. Not just from a security perspective. I'm talking the solutions themselves are not necessarily safe enough. We put an enormous emphasis on this. The automated testing, deep automated testing, is the only way that you can be sure that when you change something, it will still be safe. And you have to do that now, because even just complying with the changing world of healthcare, like I said, the best digital health solution doesn't exist yet, or it would already have taken over the world. Smart rings are not that old a technology. We're going to want telemetry in the system at some point, early warnings, who knows what. And this comes to the AI point as well. So Gen AI gets all the buzz now, but AI has been a thing for a long time. People have been trying to build AI algorithms that can do disease detection for years, decades really, but actively maybe in a reasonable way for at least about 8 to 10 years. There's a huge investment made in trying to build AI that can read radiology studies or derive information from histology. I see a huge risk in this from a safety perspective. I think there's a lot of great work being done in this space, but firstly, the time that this is going to replace actual clinicians is unclear. And us as a company, we decided not to try and build AI internally. We do a little bit, but it's not our focus. Our focus is, at the end of the day, we're dealing with physical humans. And some treatments require physical presence, pretty much all treatments at the end of the day. So the point of managing a patient and their place, position, movements in the system, I'm talking about not just in a hospital, wayfinding or something, just in the whole system. Where are people? Are they on a waiting list? Are they getting regular treatments? Is it an acute thing? They have to go to emergency? Do they have regular care in the home or in a hospital or in a polyclinic, right? All of that is a physical and administrative and process problem. It's not something that AI is going to solve. Maybe AI can help, but at the end of the day, just making a system work is an engineering challenge, not something that a fuzzy system is gonna solve. So I appreciate this was a bit of a long-winded answer, but in closing, I'll just say the you know these days digital health doesn't mean it's digital and I understand health. No one cannot be technical. Everyone needs to be technical now. That doesn't mean you need to be able to write production quality code or anything. But the advice that I would give to anybody pursuing a career in digital health, including management and process, is you've got to understand software and you've got to understand technology. It's the only way to get the right outcome. And we see this every day working with our customers. Those that do not have a technical background are dependent on us to solve that challenge for them, which we're happy to do as a company. But I really want to stress this point. If and if when we interview candidates for management or implementation positions, if they say I'm a good project manager but I'm not technical, they're not a fit for us. We need people who will understand engineering, software, and process. That don't need to be an engineer, but it needs to be something that they get.
Do you have any policy in your company to update your employees with new technologies like
Yeah,
intensive training programs?
absolutely. I mean, this is close scrutiny. So our CTO is basically abreast of all tech trends. We're actively involved in some of the kind of high tech communities. We're a very small company relative to the big tech giants, but I'm very proud that during the whole COVID, and COVID vaccination certificates moment in time where people were like, how do we validate this for cross-border travel? There was this idea to create a common certificate. So we immediately joined all of the initiatives going on, and two big ones were there. One was Common Pass, and one was called, I know Europe had a different one. We were one of the first to integrate with that as well. And there was something called Smart on Fire, which was it was mainly driven by some US companies, although it was a global effort. And I remember we joined the first, no one knew what was going on, but trying to do COVID certificates with this. The very first panel was Apple, Microsoft, and us, and Epic and Cerner and some of the big health giants. So I was proud to be involved in that one, even if we were a small player. But I think a lot of technology is stabilized enough that some common themes are there, but you have to continuously be looking at this. And I'm pretty sure we're the only company that's thrown out its core tech stack twice in this space. We had to do it. I reckon we would have a perfectly good product still on Tapestry if we'd stuck with it. But I think we made the right move, changing it. And as a company, we are, the intellectual property we have is not just the technology. That's actually a small part. It's a necessary part, but that's why it can be updated. It is the concept of healthcare and how we work in healthcare. The true technology here is the system thinking, not the language it's written in.
Let me move to this human side of the equation, because we, particularly in artificial intelligence, there is a lot of discussion now
Yeah.
on trust, but trusting is also key in deploying digital health, and you have to develop different strategies to keep trust and or build trust with your key stakeholders. I would like that you expand a little bit which are the strategies that you have implemented to build and maintain trust with your patients, healthcare providers, and other stakeholders.
Yeah, I mean, this is a huge point. And interestingly, in Macedonia, we have a very large system. So all the stakeholders kind of have to be addressed. But when we first took this, the work we had done here and commercialized it in Australia, our very first users were patients doing online booking. And it's an interesting thing. People have been phoning up. You're asking someone to trust that when they make a booking on a website, it's real and they will be seen at that time. And even this is a trust move because it's like, well, I put something in. Is this going to work? I used to upload my referral online. Now you're trying to give me a time. Is this real? So, and all the way through to clinicians. I mean, getting trust from a clinician who knows that an unsafe system is going to cause problems that they won't even see. That's a vital thing as well. So for us, the way we build trust is, and it depends a little bit on each deployment, right? But the core principles with clinical users is lots of training, lots of hands-on time. I didn't really talk about it before, but our whole idea as a product, the core product we have is that it is very configurable. So we actually can build in a tool clinical pathways in like a visual tool, and they just become production. So when you sit with clinicians, they'll say, listen, these are the rules and this is how we work in this hospital. And we can just build it together with them collaboratively. That builds enormous trust. They can see how in front of them the pathway is taking digital shape, and they see how fast that is. So they know that if there is a problem, it's not some 6-month exercise to fix it. That creates trust, and it also creates confidence, but nothing replaces user engagement. I used to think that has to be in person and face-to-face, and we do a lot of face-to-face. But because of the pandemic over the last 3-4 years, we actually have customers that have gone live and have never met us in person. And I'm very proud of that, because in healthcare, it means that the way of working is as important as building trust as the traditional getting together with people. And that kind of collaborative, show them the tool approach. I've noticed this with our marketing as well. A lot of times when you look at marketing for digital health products, there's no image of the product. There's just a description and discussion and talk. I actually went to a sales pitch for one, but not a competing product. We were brought in by a customer to see it. These guys talked for 45 minutes without showing the product once. It would be the best product in the world, but why, what did we just spend 45 minutes doing? All of our product demos and even our early implementation demos, we literally just pull the product up on a screen share. If I'm with someone physically or one of the team is, you just hand them the mouse. They look, go for it. This is the product. We have to set it up for you. It's a project, but that moment of being willing to just say, let's click in our solution, is a very big and very early kind of trust move. The other thing is the auditing and tracking. Users will come in and say, how do I know what's happened in the system? We had this philosophy from very, very early. And it ties back to the principles around security and even regulatory compliance. We have a core philosophy that everything in the system has to be on some kind of immutable log, because you have to know what happened and you have to know who did it. There's these common processes that get talked about, like named accounts for users. You have to know who clicked this button, who took this action, from a compliance perspective, from a security perspective, but also from a trust perspective. That's talked about the least, because people hear compliance and they associate it with trust. But one thing to be trusted as a thing that complies with the rules. It's another thing to be trusted by a user who says, using this system is safe and it will get me the right outcome. And that's something that, we really, nothing replaces good delivery here, and demonstrating to a user that you understand their world. I had one of our customers, I was very proud of this, say, listen, I've seen some other products in the market. I think yours is definitely the best we've seen, but maybe there's something better out there. But they said, that doesn't matter. You guys aren't the cheapest, right? And we had a mandate to buy cheap, but you understand our business and our way of working. And I was very gratified by that. I mean, I think we do, and our team does. In that particular instance, that was a radiology practice. But, that meant so much to me, because that's our goal as a company. And that's why they should trust us, because we know how they work. We have very few clinical advisors on staff. I want to have more, but we aren't there to understand exactly what the doctor does or the clinician does. We're there to understand their world. So I'll give you an example. I asked very, very early on in the history of the company, before we had this level of understanding, I said to a hospital doctor, a clinician in a hospital, I said to him, what's the biggest annoyance you have in your day? And whatever I expected, it was not the answer. He said, it's walking. I spend a third of my day walking somewhere to find out information. I'm happy to walk somewhere to do something. I'm walking somewhere to learn about something that should be in front of me on a screen. That was a great hook, because then I showed him the digital health backbone in Macedonia, and he was absolutely delighted, because we have an integrated medical record here, like Catalonia. It's a great system, and it works very well for clinicians. But that moment of, I didn't expect that that would be so consciously painful for the user. And I think actually that was prescient on the part of that clinician, because a lot of folks don't realize that, you know, clinical professionals are always busy. And I'll give you one more little anecdote about this. If you had asked a specialist here in North Macedonia before the electronic health reform what their day is like, I reckon 90% would complain that they're just too busy. It's always full, it's always chaos. I reckon most of them will still say the same thing. But thanks to the digital health system, they actually deliver measurably. I mean, we have the statistics to back it up, and a study will come out soon. They deliver 50% more healthcare. They see 50% more patients. And there's been a few small studies measuring the time they spend with patients, and that is also increased. So if the complaints haven't changed, I wish their experience was better, but they are delivering vastly more value into the system. And that's something that, that's something I'm very proud of. So to return to the original question about kind of building trust, anecdotes, even like the one I've just told, help us explain to users, we're not doctors, but we understand your world. And most importantly, we understand what goes on in your day, right? And that's the most important thing. When you work with digital health, you might think technology is the winner here. It's not the technology. The technology is there to solve the problem. And the problem is what happens every day with people, what their daily experience is, and how they spend their time doing healthcare. And as a company, that's where we see our greatest impact.
This makes me think in another element, because I think we all agree that end user adoption is key in the implementation process. And I can see from your examples how you have dealt with this. But many digital health companies, they have a good use case, but at the moment of truth, they cannot scale up. You have some experience of large scale-ups nationwide and in different countries. I would like that you share with us how you have approached the scaling process in these different elements, and what was key in this process of spreading the innovation across the country.
Look, and this is a question I get asked, and it's a great question, because the speed that the healthcare reform that was executed, the digital health reform here in North Macedonia, was lightning fast. It took a year only to connect most institutions. And then the same solution was deployed in Serbia next door. That took 6 months to have most of the country in a single medical record. It's a huge achievement. Obviously, I'm proud of our role in it, but it's the users too. The people we worked with and their willingness to get on board with a new technology was crucial. This would never have worked if we didn't have that buy-in. But scaling in healthcare is a huge challenge because of process fragmentation, because of regulatory fragmentation, and at the end of the day, it's an extremely brownfield market. There's always some health solution out there, some technology that people are using, and you're not just asking people to use a new tool, which is already a change. You're asking them to stop using an old tool, almost always. So there's a few things we did to address this. One was also, this kind of goes back to that point about building trust. We started with something that you could bolt on. And that enabled us to say, look, you use it, you just keep working your way, but we will bolt on a solution for patients, in this case it was, right? And electronic referrals. This plugs right into your business. We'll integrate it. That's a challenge, and a cost to the business, and a risk. But we'll integrate it and see if you get an outcome. So this is actually something that we do to build trust in a new market as well. We do things that bolt on. People use them. They like working with us. They see that we understand their world. They see that we understand it enough to integrate with legacy software and solutions. And then we build up a reputation, and then we can scale further. The interesting thing about scaling in healthcare, and I am optimistic that graduates of the BTS program will go on to be senior leaders in digital health globally. And I want to leave this message with you. It's a big message. Ironically and bizarrely, going big in healthcare is easier than going small. What I mean by that is this. If you have a successful healthcare pilot in one institution, at the end, you have a great pilot, great outcome, and only one institution live. And that maybe took a year. And now you go to the rest of the market and you say, okay, look how it's working for these guys. Let's do it everywhere. And the rest of the market says, oh, I don't know. We're not like them. We're different to them. Let's do one of us at a time. By the time you do 10 hospitals, one a year, 10 years have gone by, right? Everyone's working on new frameworks. Everyone's got new technology. Something else has happened. Everyone's wearing a smart ring. I don't know what will be the market in 10 years. All I know is that people will still need to somehow get healthcare by physically turning up to the location where it happens. So that was the lesson actually from here in North Macedonia and from Serbia. And I call this broad but shallow. If you change everybody to one way of working for just a part of their day, you've created a common language. You've not displaced a lot of what they already do. You're not trying to change the whole system, or what they call boiling the ocean is a great English phrase that I use all the time. You know, you're allowing everyone to do something the same, and everyone benefits from this. So here in North Macedonia, the key reform was all referrals and their output have to be electronic, and they have to have an ICD-10 code, a diagnosis code. ICD-10 is not a full clinical ontology, at least not the way it was implemented here. It's just a way of saying in one phrase, number and a phrase, this is what's going on with this patient. And that was huge. I got a fun anecdote here. There was a sudden cholera outbreak when the system was put in. Of course, there's been no cholera here for, a century or something. But everybody was just clicking the first code, A00.0, cholera. So the minister went out and said, guys, stop it. And then compliance got better and the cholera magically went away. So once people understood, if I send this code, I'm not going to get a phone call. Hey, Dr. So-and-so, I'm reading this report, man. What's going on with patient XYZ? Then they have to look it up in their record. Let me look this guy up. I'll find out what's happening. These are terrible conversations that waste time of two clinicians every time, plus getting together at the time. Like this, even if the notes didn't come through, made no sense. Okay, they're here for, I-10, hypertension. I can work with this, right? That moment gave an immediate benefit to the whole market, enabled them to start speaking one language electronically, and was not such a process change that it required 10 years of training. So that moment of broad but shallow is actually easier than going pilot by pilot, clinic by clinic. It takes enormous political will. It's rare that there is such a procurement mandate, or ministerial mandate. So again, I'm hopeful that ETS graduates will have the opportunity to have such power in the future and take this message with them. But, healthcare is interesting because it's a place that has resisted standardization for a very long time. Many reasons that are probably out of the scope of this talk. But, we learn from doing things this way that when you enforce a standard, it can't be a big standard. It will take too long and it's too hard. It has to be a small standard. But if you enforce enough of it, everyone's on one railroad. It's like saying to the market, you all drive different types of vehicle, some on the left and some on the right. Now we're all going to drive on the right. Less accidents, less collisions, the roads are cheaper to build, and so on and so on. So that moment is a big deal. Now, how we scale as a company kind of goes back to something else, which is when we go to private customers and the risk is big to try and go forward, then you do have to do a pilot. But we try and set it up to say, look, let's do a deep, deep, deep pilot in one place. And if it's successful, and everybody comes and sees that place from the rest of the country or the region or the municipality, whatever, then it goes to everybody. So it's not one by one. And that's a battle. But if you do it the right way, and if you get the user buy-in, then that allows you to scale a pilot more. I don't have the best, how do I put this? That's not a surefire way. Everything in healthcare is a bit unique. Everything's a challenge. So that's not a guarantee that your pilot will scale. But that is an important thing. And the last thing I just want to mention, and this is a point I think that is also general in healthcare, because of the fragmentation in the market and so many different processes, a conscious decision we made, and this goes back to those, what I mentioned earlier, where we've rebuilt the product twice. And this is kind of the last thing I want to leave you with as a general theme. We built a product that is very configurable and can be set up or rearranged to meet the needs of very different healthcare systems, partly to support us going global, because we see the world as our market, not just single countries, and partly because it means that you can sit with a clinician. And it's taken us years to get here, but there's something that I dreamed of doing for maybe 8 years with our solution. And that is being able to sit with a clinician and they tell you how they work for some particular clinical process. And you mock it up live in the solution. So we can do this now. This is it's the pathway builder in our product. It's a tremendous workflow tool. That doesn't mean it's ready to use. You still got to test it, validate it, run all those clinical validations that we were talking about before to keep the system safe and trustworthy. But it means that you can sit with the clinician and say, is this your world? If it takes a month to build a pathway and you have a system with 400 pathways, you either try and parallelize it, put a huge team, it's impossible. There's actually a tipping point in the scale. It's like a sigmoid where suddenly impossible becomes easy, not easier, possible, easy. From no to easy, not to yes, to easy. That's the part that we've I think almost achieved with our solution. I say almost. We've done this now in production, but there's still more refinements that we are continuing to make to the product. We have an ongoing development track, but that ability to reconfigure the way that the system works in a way that is consistent with our core data principles and model. That's why we have a clinical solution in 6 countries, but now we're expanding to more, and enables us to adapt to differences and essentially provide the same core solution, even into a fragmented market, with minimum transition and change from a time and project perspective to enable us to serve everybody in that market. And that's another way we do scaling. But most important thing, broad but shallow. Going big in healthcare is actually easier if you do it right than going small.
Thank you, Dalibor. This is very insightful. I have another question, but I want to keep it because I'm receiving questions from the audience and I would like to prioritize them. The first question from the audience is related to AI. The question is, having AI ramping up with new innovations and use cases, any thoughts on AI as it relates to how the healthcare industry will manage in terms of regulations? And here, I guess the question is worldwide. So
yeah.
maybe different answers.
I think there's still unknown risks with it, right? I mean, I saw some jokes online. Someone asked Google's AI how to make a pizza, how to make the dough better or something, and it said you should use glue in the recipe. They call them hallucinations, but it's deeper than that. The way Gen AI works is not good at facts, right? It is a heavily weighted random number generator. Using AI or AI ideas, and some of this is just machine learning, right? They call it AI now for marketing purposes, but it was like they rebranded material science nanotechnology. It's the same thing. So regulating this stuff to enable it to be put into production clinically is, I think, a long way away. And I think the world has been burnt enough from several technologies that kind of got big before they were properly controlled, that we will see more of a push to have sensible regulation before these things enter production. On the flip side, there are areas of healthcare that have very little control because they're not directly clinical. And we will see a lot more AI there. We're actually involved in a series of Gen AI projects around customer communication and patient communication. But the AI isn't there to determine what you say back to the patient because of that risk of incorrect information, unacceptable risk. It's there to help manage a process, allow someone to talk to an agent and get a booking time for healthcare, this kind of stuff. That is, when you're using the AI as a communications tool or as a generator of real sounding fluff. I don't mean that to sound dismissive, but the moment where you're communicating with a patient can greatly benefit from AI. And actually, Tino, you told me a remarkable story here that I didn't expect, which is people were doing a questionnaire, like a pre-arrival questionnaire, talking to an AI. And the feedback was that the AI was more polite than a human would be, and they liked that, right? That's where I see a real use case. The questions are structured. They have been laid down in some kind of regulation, for that process. All the stuff around them, that can be AI. So long as the correct information goes into the correct field, and that's an engineering problem, not a fuzzy AI problem, then that's good. But yeah, short answer is I think this will be being regulated, in the process of being regulated, for years. It's moving very fast as well, so it's also unclear where this world leads. But the most powerful computer that we know of is the human brain, and it takes 10 to 20 years to train one of those to do healthcare the right way. I don't see the computer replacing that just yet.
This links me to the next question, which is about training. Specifically, is what kind of technical training or knowledge do you recommend for a medical doctor who wants to be involved in the innovation processes? And what's the benefit to take a master in digital health for a physician?
It's a very interesting question. Look, it's my opinion that digital health and digital tool use should be introduced into the beginning of all medical curricula, because the reality of healthcare is a clinician is doing vital work and complex work, but no one does the whole treatment on their own. Even if the doctor is the one that is directly treating you, they rely on a system around them. And that system is best connected digitally. So digital health and digital health skills should be this. And unfortunately, the job is data entry, right? But you need the right skilled person to enter data in the right way. So I think the benefits to this master is why I'm so excited about it. And I was so excited when when I was invited to join for these talks. Clinicians, at least in many of the countries where we operate, tend to be the ones in administrative positions, senior administrative positions, in hospitals and hospital systems and insurance companies, in government ministries, in public health institutions. And digital health is how everything will be managed. Even places that aren't all the way there, it is inevitable that everything will be run technologically. I see this as a fundamental inevitability, and being ready for that is a career move that opens you up to basically it will be a required credential, even where it is not today, to have this kind of experience. And from a general technical education perspective, I don't think it's useful for a clinician or someone pursuing this line necessarily to learn to be a software engineer. That's a complex discipline in and of itself. You don't need to understand how to build a technology to understand technology. And I do see a training gap, and this master's is one of the things that addresses this. Is, like I say, terrific that this exists. Is software isn't clicking things on a screen, right? Software is a much more fundamental concept of what it is you're engaging with. What is an information system? And there are principles here that would benefit any clinician who seeks to become an administrator. The other thing is kind of software and process engineering are a little bit two sides of the same coin. At least I see it that way. You won't necessarily get that answer from our engineers, but the understanding the software development cycle, the software release cycle, some of the trends that have gone in software. I'm even talking high level stuff, waterfall software development, agile software development, the way the world works now. This is something that any clinician will benefit from, even if they don't intend to be an administrator. And that idea that there can be a common place where there is information and you are engaging with, writing to it, fetching from it, right? That's the cloud and the tools that we use to engage with it. This is essential. And last but not least, you asked me kind of what courses people should take. I wish I had a direct answer. Our CTO is best at pitching technical courses, but for me, it doesn't even need to be a technical course. The best thing that people can do is just gain a high level understanding of how web apps are built, how they work. Even now, we engage with users directly, and users will ask for things. They'll say, I wish the system could do this for me. And sometimes they get it, and sometimes they're basically saying, can you make a button that reads my mind when I push it? Maybe that's the next thing after AI is going to be brain reading. but I haven't seen any technologies that are reliable on that score just yet. So, you have to say to them, look, this is, and they would benefit from this experience, to understand, look, the system can only add to or modify blocks of information, and it has no context. Even the AI might allow a system to feel some kind of like it has some kind of context, but that's risky. Assume that software systems have no context other than what is programmed into them or built into them. Just to tie back to what I was saying before about that pathway builder we have, the idea of process engineering, I think, is actually also key to understanding digital health and software tools. And clinicians might benefit from this too, because sometimes something that feels like it's efficient is not. I'll give you a classic example. There are still folks in clinical practice who just love writing something down. Paper is one of the best interfaces in the world because the paper knows everything that's in your head, right? Everything that's in your head can be written in a few seconds. And then, even if you feel like you've just done a job, you haven't. That now has to go and communicate to a system. So that jump is a emotional leap as much as a skill and engineering one. And understanding a little bit about process engineering, how information works in a digital system is of enormous benefit to, I think, anybody in clinical practice.
Thank you, Dalibor. I think your answer will be appreciated. I want to close actually this talk, but I want a burning question that I would like to ask you. And this is related to the what our masters, our students are doing, and they would like to ask you, that is, what would you recommend to the, let's say, 25-year-old Dalibor back in time after the experience you have had in this journey into digital healthcare? What would be your recommendation for those that are now in the situation you were, I don't know, 10, 15 years ago?
Honestly, the thing that I did that was so useful is spend time inside an institution. Spend a whole day at the front desk of a hospital. Spend a whole day following a doctor around. I don't know if you'll be able to do that as a 25-year-old, but through the program, I think opportunities will come where you can observe people working. Watch people in healthcare practice do what they do. Watch them use the software. Spend an hour playing with a piece of clinical software in some test environment and try and be a doctor in that software, right? Get 5 friends together and pretend that you are running a practice, another practice in a hospital, right? And exchange information. Nothing gives you more of an understanding of what actually happens than being in a clinic. And, finding the opportunities to do that. In our case, it came through what we did as a company and the solutions we were building and deploying. But, nothing can replace time spent at the front desk, in a doctor's office, even in a surgical theater is probably not a place where you just be able to stand around and observe. But, you can get some access to that in videos and things. Watch how people move. Watch what they do. Watch what they say and handwrite on a piece of paper. Go to any ward in Australia, for example, and every single nurse, with few exceptions, has not a notepad. They have a single sheet of paper that they're folding and writing on, and they know which page, which little flap is for which bed, and then they go and write it into a computer. Watch that, and you will have more ideas than anybody in digital health today. Right? Well, except people who are already doing that. But that's that is my most recommended thing. Be in that world and see it. Nothing can replace that experience.
Perfect. Thank you very much, Dalibor. It was really amazing talk with you today. I want to thank you also, BTS, to make this happen, and also the audience that were participating and listening to this talk. Thank you very much, and we will see you soon.
Thanks, Tino. Thanks, BTS. Thanks all.